You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says no more dentures. With us, we have an expert on the topic, board-certified periodontist, Dr. Jackson. Dr. Jackson, welcome to the program.
Thanks for having me.
Now, before we get into today's topic, for people that don't know your practice, as a periodontist, who's your typical patient? What are the different services you offer?
So, I mean, you know, I get a wide variety of patients. 90% of my patients are referred in from other dentists. And patients come in, they're missing teeth, they have gum disease, recession. Some of them just want a second opinion. So, you know, we get a wide variety in our practice. So a lot of these patients come in, they're either going to be losing their teeth or they're missing their teeth, and they want to know about dental implants. Dental implants it's a huge part of my practice these days. I mean, you know, we see a variety of patients, and it's been quite an adventure.
Now you say, or we said at the top of the show, no more dentures.
Right.
You believe? I mean, is that what you'd like to do in your area? Wipe it out? Nobody should be wearing traditional dentures?
I mean, Randy, you know, I got to tell you, dental implants revolutionized dentistry. The all-on-4, these 5 to 6 implants and a fixed denture, that changes lives.
So like 5 dental implants and they get a full set of teeth that don't come in and out?
That never come out. I mean, it's amazing. It transforms lives like you can't imagine. I mean, patients come in, and I got to tell you, I have patients from 42 years old all the way up to 88 that we've done this procedure on. And none of them have ever said to me, gee, I wish I never did this. They've been happy. They walk out of my office. Sometimes they eat that same day foods that they haven't eaten before or had for years. And it's a life changer. It really is.
Now, when I hear things like on your website or whatever that they can walk in without teeth on the day of the procedure and walk out with teeth that don't come in and out.
That's correct.
Is that right?
Yeah, they
same
walk
day.
in. So they go home, and that same night they'll have, you know, pizza or pasta.
The same night?
The same night. I mean, it's amazing. Actually, you know, sometimes actually we'll give them an apple in the office to chew on. So they come in, you know they're losing their teeth or they're wearing a denture and they haven't had these foods for years. And all of a sudden you give them an apple and they bite into it and the smile comes over their face. It's amazing. The transformation, it's a life changer.
Do you tell them to take it easy though on soft foods at the beginning?
You do, but you know, the reality...
Like a month later, what could they eat?
No, so it's actually the first 2 weeks is not as important as the 2 weeks to the 1 month period. So they can actually, for the first 2 weeks, they can eat a little bit more and then they have to slow down. So we tell them when they're in the office, hey, have a bite of an apple, and then you just want to see the look on their face, and then you say, listen, okay.
Are they afraid?
They're not afraid. They're more curious than anything else.
Okay,
they're curious. I mean, they're like, wow, you know, I just walked in with a denture, and all of a sudden this guy placed implants, and he's giving me a fixed prosthesis, a full complement of teeth, and he's saying, eat an apple? Come on, I haven't had an apple in years. You know, they've been using C-Bond or some adhesives, and all of a sudden it's like, you know, go ahead, try it. And it's they bite into it, and this huge smile comes over their face. It's amazing. It really is. It's an instantaneous gratification for me, and I can just imagine what they're going through. So the most amazing thing is actually when you give them a mirror. They look in the mirror, and you know, these people, they've been losing their teeth are flaring, you know, they've got periodontal disease, they may be missing most of their teeth. You give them a mirror, and all of a sudden they look in the mirror, and they have this great smile. I mean, it transforms their lives. It's just the most amazing thing you've ever seen.
That's good. Okay, so I guess there's 2 types of people, and we talked on the phone.
Right.
The people that are already wearing dentures, and then the people that are about to lose their teeth and are headed toward dentures.
Right.
Let's talk about the dentures. Are there really a lot of people with dentures? Like in your area?
I mean, God, there are millions of people wearing dentures in the United States. My area alone, thousands, tens of thousands. You know, we've got people who are missing their teeth, whether it be one single tooth or multiple teeth. But I mean, we've got thousands of people who are walking around every day. That's why the denture adhesive market is huge. I mean, it's a multi-billion-dollar industry. You know, my goal is to eliminate it.
Okay, good.
I mean,
no more dentures.
No.
Well, if it's so good though, like you say, tens of thousands of people in your area.
Yeah.
Why aren't they all doing it? Why aren't they all coming in to get it, you know, locked onto some dental implant?
You know, here's the problem. People who are in dentures already, it's, you know, I look at it as being a process, okay? You know, they've gone to the dentist, they've had their teeth out, they've gone through root canals, they've had multiple things happening over their lives. They get their teeth out, they're relieved. Okay, they get their dentures, they're finally comfortable now. That's the one reason. The next reason is
So they don't want to come back to the dentist.
they hate
done
the
with
dentist.
you
They hate the dentist. I mean,
Do you hear
kidding?
that, by the way?
Oh yeah,
Like,
all
no
the time.
offense?
Yeah. Oh, my
Because
patients
the
walk in.
periodontist, nobody, you know you're in trouble when they go to the periodontist, right?
We're the worst of the worst. I mean, they come in, they're like, I don't like you. I'm like, great. I'm like, let's see what we can do to change that. But I tell you, when we're done with them, I'm their best friend. I'm a family member. I mean, I still get letters from patients who we gave the implants with the fixed dentures, the fixed prostheses, and they love me. I mean,
Okay, good.
it's I get more wine from them from
So
my
the
friends.
number one reason is because they don't want to go to the dentist, so they don't do it. What's another reason why they all don't come?
They probably don't even know their options. I mean, they probably don't know. They haven't been to the dentist in years. They got their dentures. They feel like they don't have to go anymore. So they haven't been in. They haven't, researched
So
their
nobody's
options.
telling them, you think, to do it?
I think that's probably a big part of it.
Yeah, but isn't it true that if you've been wearing dentures like 30 years, you don't have enough bone, or it's too late for you?
It's so funny you asked that. And actually, it's funny, but I still have some dentists who believe that. I mean, we have imaging, we have CAT scans, dental CAT scans these days. I mean, we have ways of investigating, finding out if the patient's an option. It's a quick scan. It takes 15 seconds. I mean, the reality is 70% of patients that walk through the door are candidates without additional grafting. I mean, we have ways of growing bone. We have new techniques. We can grow bone in areas that we could never grow bone before. So dentistry in itself has changed dramatically over the last 10 to 15 years. We're placing dentures in patients, we're placing implants in patients who, were told that they could never have fixed prostheses.
When you say fixed prosthesis, we're talking about a full arch
full
of
arch
teeth
of
that
teeth,
stick
yeah.
in their mouth.
Yes.
That don't come in and out.
No,
Okay.
they're stuck. They're there,
So you were saying that they've been told at another dentist,
Yeah.
you don't what? You don't have enough bone, you're too old.
Another dentist will look in their mouth and they've either been wearing their dentures for years, and they say, gee, I'm sorry, there's not enough bone here. The reality is they do have enough bone without additional treatment.
And why are they being told that?
I think part of the problem is there's a lack of dissemination for knowledge. I mean, so something new comes out, and dentists, we're very slow adapters. You know that, I'm sure. You've been working with us for years. We're slow adapters. So, we're still practicing what we learned in dental school. And all of the newer technology is, if you want it, it's there. And the dentists, they don't seek it out. So you go into a dentist, maybe he's been practicing for 20 or 30 years, and he looks, oh, you've been wearing a denture for 20 years? I'm sorry, there's not enough bone. There is enough bone. There are very few patients. Actually, I could tell you, I've done a lot of cases, and I haven't had one patient that we
That you
weren't
had to turn
able
away.
to. Never, not once.
Now, you're a specialist, okay? As a periodontist, do they need a referral to see you? I mean, can they see you first, and then you work together with their general dentist?
I get a lot of
Is that how
patients.
it works?
Yeah, I mean, I get a lot of patients that want to come in. They come in for a second opinion, or they're referred in from their family members or friends. There's a lot of cases that I'll treat. So it's actually nice to be able to have a patient come in who doesn't have a dentist, and they want to find out what I think.
Now, you're a specialist, so do you have a bias? Do you feel like that if somebody's going to get a surgical procedure or dental implants, they should see a specialist? Because I know that a general dentist can do this. Is that right?
Absolutely, anybody can do dental
Does it cost
implants.
more to go to a guy?
No, it doesn't.
that's a
It doesn't
specialist?
cost any more. But here's the thing: you want to go to the guy that's done 1,000 of these. You don't want to go to the guy that's done 5 or 6. If there's a problem, you want the person who's really well trained in doing
Okay.
implants. So I mean, I've done 7,000, 8,000 implants in my life. There's very few things that are going to come across my table that I haven't seen already. And you go into a guy who's, maybe taking a weekend course, and all of a sudden they're like, oh, I think I'll try, doing one of these all.
So just ask your doctor. I mean, have you done over 1,000 of these? Or a couple of thousand of these?
Well,
because that's very intimidating to ask.
I don't want to, listen, nobody should be put on the, if somebody feels comfortable doing implants, great, good for them.
What's the diagnostic process like? Like when you meet a patient, how soon before you say, this is going to work? And do you see the end result?
As soon as I see the patient, I take a look at the CAT scan, I know what their final product's going to look like. I've already imagined it. And
Really?
it's the process of taking them from either they're losing their teeth, we're going to take out their teeth and place the implants and give them a fixed set of teeth the same day, or they're wearing a denture already. So they come in and I've already seen the end product. I know what they're going to look like. I know how they're going to function. And that's part of being a specialist. I mean, that's what training gives us. It's 3 years of being beat up.
And I know you brought photos. We're going to get to those in a second. How old can you be? Like, what are some of the oldest patients doing this?
I mean, I've treated patients from 42 years old all the way up to 88. And it's amazing to me. You really can't judge a patient by their age anymore. 80's the new 60, right?
Are they more likely to fall out, though, if you're 85 years old?
No, not at all.
Statistically?
No.
You guys know?
Age is not,
really?
No, age is not a restriction. I mean, there's certain things that you have to look at. The patient has diabetes, uncontrolled hypertension, things like that. But I mean, no, these work in all circumstances. It's amazing. So, age really isn't a restriction. The 80-year-olds, they come in and they want to have the same quality of life as somebody who's a little younger, right? Why should they have to be limited by not having teeth? This is what they enjoy. I enjoy food. It would be devastating for me not to be able to go out and eat. It's funny, when I was preparing to come onto the show, I was thinking about this, and I realized my grandfather, he wore dentures. The way we used to get rid of dental disease, gum disease, was to take out all the teeth and give dentures. And it occurred to me, he'd come and stay with us for a week or two, and my mother would sit down for about a week and start stressing about what she was going to feed this guy. He could only eat certain foods. And think about that. It's like you have to revolve your whole life about where you're eating, how you're eating, what you're eating. It's ridiculous. This is an alternative. You can walk in, go anywhere you want. You're not going to worry about your teeth falling out. You're not going to worry about, oh, gee, I can't eat that because it's too hard. It's just a change.
So I know a few denture wearers. They never complain. Are you saying that all denture wearers are miserable?
Well, I would say that most denture wearers who are unhappy are not going to complain to you.
Okay, good point.
That's the general public,
I'm
right?
not a dentist. Okay.
Right, exactly. So, the denture wearers that come into me, they're unhappy. Their dentures don't fit properly. They've got sores in their mouths, and they can't eat what they want. Nutritionally, you got to think about this. Most patients who wear dentures, they do not have a good diet. They can't get the fiber that they need. They lose weight. Actually, if you look at statistics, patients who wear dentures are much more malnourished than people who have fixed teeth. And with the 5 or 6 implants or 4 implants and a full complement of teeth, it's 90% as effective as your own natural teeth. And that's what they found. So it's, for me, this is a game changer. It really
you love
is.
You love doing this?
I love changing people's lives. It's such a pleasure. It's an honor, actually. It's to have the patient come in and they've been told by other dentists, or they've been told that maybe they've self-diagnosed. Gee, I've been wearing dentures for a while. I don't think there's an alternative for me. It changes their lives.
But it seems painful. It's got to be painful.
Actually, it's amazing. This is the least painful thing that we do. I do gum grafting in patients, they are uncomfortable, or bone grafting and they're uncomfortable. This, you call them up at night. I call my patients at night just to check on them. Are you taking the medicine? No, I don't need it. Took an Advil. It's amazing. It really is. I find it hard to believe.
So pain should not keep you from trying to do it.
Listen, people still do things that you have to get it done. So you want to change your life, you want to be happy, you want to eat where you want to eat, you want to date again, you'll go through a little discomfort if you have to. It's not a lot of discomfort, which is the amazing thing. You think it's going to be. My God, they come in, you're putting implants in. I tell you, they're not only are they not uncomfortable, but they're really not very swollen either.
Now, just to avoid having to put disclaimers, pain is, everybody experiences it differently, or it's not typical.
Right.
But the truth of the matter is some people don't complain about pain at all.
Their patients don't even take Advil. It's amazing.
Okay.
Hey, listen, I got patients that come in for a cleaning and they want Percocet.
Okay, so some people, it's different for everybody, but
of course,
for the most part.
It's the individual.
But the bone doesn't really have feeling, right?
The nerve, most of the pain comes from soft tissue. It's not from drilling into the bone. Yeah, that's where the discomfort comes from. So, it's a minimally invasive surgery, and the patients walk out and they've got this fixed prosthesis. The other thing is there's no denture sitting on the tissue to compress it anymore, right? Think about it. That's where the discomfort comes from. So all of a sudden, they've got this fixed prosthesis. They've got the full complement of teeth, and they're comfortable.
So you describe it like a new lease on life. These people can eat and chew, and now that I guess they don't have to worry about their denture anymore, their teeth.
It's a life changer. It's a life changer. They smile again. They They eat again. I mean, they thought they're doing things they never thought were possible.
What are the options? Okay, so a denture wearer's a person wearing false teeth walks into your office.
Yeah.
What are they presented with, like as far as options for dental implants?
Okay, so if they walk into my office and they're missing all their teeth, we go through the options. You can have the 2 implants with an overdenture, which is just a snap-on that comes in and out. You can have a bar-retained denture, so you put in 4 or 5 implants and you give them a bar. Or you do
Again, snap in, snap out. Full set of teeth, though.
Right.
Okay.
Or even better, you're still putting in 4 or 5 implants, but now you're fixing a prosthesis and it doesn't come out. I mean, so it's more like your natural teeth.
So a fixed set of teeth.
Fixed set of teeth.
They don't come.
Well, 5 or 6 implants.
That's what everybody wants, right?
Yeah.
So
I mean, are you kidding? If you were to lose your teeth, what would you do?
Well, obviously, I would want to get these implants, right?
Yeah.
And I'm not trying to side with you, but logically, it makes sense.
Of course.
So is this the future of dentistry? Where, like, there won't be traditional dentistry, whether it's 20 or 50 years from now, but there will be no more dentures?
I would say yes. I'd say this is the most important thing. Here's the reality. When you place an implant into somebody's jawbone, not only does it give you something to anchor to, but it helps maintain the bone. So they don't have all these nightmare aesthetic problems where their face sinks in, or they look, those short little squatty faces that you've seen where the patients have lost a lot of vertical dimension, lost a lot of height.
Okay.
I mean, so yeah, dentures are the standard of care. Implants are the standard of care. Sorry about that.
Okay, good. Now, you brought photos. What are we looking at here?
So let me tell you about this patient over here. She's in her 40s, young to be losing her teeth. She's had dental problems for years, just one of our typical patients. She was told she was going to lose her teeth, and her only option was dentures. And she was not happy with that answer. She's had problems for years. Her teeth are flaring. She's lost vertical. She's uncomfortable.
All right.
Her biggest fear is, and the reason she hasn't done anything, because she was told 5 years ago she was going to lose her teeth, the reason she hasn't done anything is she doesn't want to go into a denture. She said, that's not the answer I'm looking for. There's got to be something better.
That she found you.
Well, she was referred to me.
Okay, good.
She was referred to me from a friend, a good dentist, and she came in and I sat her down and I said, hey, I took a CAT scan. I said, you have any option you want. So I said, I can place 5 or 6 implants and give you a full set of teeth, full complement of teeth. She said, great, let's do it. The transformation.
Wow, she looks happy.
Are you kidding? I still get wine from her. This was 3 years ago.
Okay.
Think about that. Christmas gifts, her life was changed. So, look at the difference. She's happy. She's smiling. You can see her picture. Her life has been changed. She came in, she was concerned.
She was kind of tired in the before.
Yeah, she was
kind of worn out, and now
She wasn't tired, she was scared about the answer. She came into my office, she was told by her family dentist that she was going to be in dentures. She was scared. She didn't want to hear me tell her that there were no alternatives. She wanted to hear, hey, I'm going to fix you, I'm going to make you whole again. And I think the picture shows, it shows that.
And she just comes in for cleanings? Like regular teeth?
She comes in once a year.
Like to her regular general dentist?
Well, I think she comes in once a year to drop off a bottle of wine. I'm not sure, but here's the biggest thing. These patients, they come in, they're unhappy about what their solutions or alternatives have been. And think about somebody that goes in for a job interview, and you can take a look at her. The one picture, she's unhappy, she's frowning, she's kind of concerned and scared. And the other picture, she's happy. She's smiling. She's warm. She's got confidence again. That's what we gave her back.
Looks like a different person.
Yeah, we did. We gave her back her confidence, and she's happy. So let me tell you about another patient. She came in. She was just recently married. I think actually this may have been a wedding present from her husband. She had lost all of her teeth through neglect, periodontal disease, and she was concerned. You couldn't see her teeth. You can see her upper teeth. And you can see from the picture here, she's she's giving a fake smile. And then she comes in, we tell her her alternatives, we go through all the steps, and I swear, I'm getting fat for the amount of chocolate she's sending me every year. It's unbelievable.
All right, this is the after. Wow.
Yeah, she was really happy.
Very nice.
She was really happy. She was a very sweet lady, too. And the other thing is, when she first came into my office, she was wearing makeup to try and make herself feel better. She comes in again. She doesn't even wear makeup anymore. She's just so happy with how things turned out. Cosmetically, you can see she's a pretty lady.
They look like regular teeth, by the way. So those are like dentures that don't come in and out? It's like a fixed
They're
set
fixed.
of teeth?
Yeah, they're fixed. The only people that can take those in and out for her are the dentist. And look at the difference in the teeth. I mean, the dentist made the teeth look natural in her mouth. They mirror her lip line. They're fit to her.
They're like curved.
Yeah,
They have,
they're beautiful.
So the process as far as designing the teeth, the patient's in on it at
Yeah.
all? I mean, do they get to kind of pick their smile
Oh
a
yeah,
little
of
bit?
course. Yeah, I mean, we give them options. The dentist goes through. They make up a mock of what they should look like, and then the patient comes in and say, "Yeah, I like this. I don't like that. I want you to change this." A lot of patients bring in pictures of when they were younger, and we give them the teeth back that they had when they were young. It's amazing. It's a life changer. It really is.
Now, the smile. You say they smile more. You're a periodontist.
Yeah.
You're a dentist. You think the smile is pretty important. How important is the smile? Because you say a lot of people with dentures don't smile.
It's the first thing I look at. I mean, think about it. All the magazines, when they do interviews or they say, what's the most important thing? It's a smile. I mean, 90% of our body's covered up anyway. So the first thing you see is when I meet somebody, if they're smiling, I know they're warm, they're comfortable with themselves. People who don't smile, it's, there's something there, it's something reserved. So let me tell you about a crazy story. I got a call from one of my good referring dentists one day, and he says to me, "I'm going to send in a patient. I don't want you to say anything to me about the patient. Just, do the exam, take the scan, and let's talk about the options." Okay, this is where the story gets interesting. This guy has 9 teeth in his mouth. 9 teeth, okay? 5 of them are abscessed. They're infected horrendously. This guy is the dentist's father. And it gets better. Let me tell you the story first. You're not going to even believe this. So this guy comes in, we do the scan, we go through the alternatives. We're gonna take out the remaining teeth. We're gonna place 5, 6, 7 implants and give him a fixed prosthesis on the same day. Guy comes in, we do the whole thing. You want to know the crazy thing? This guy's a dentist himself, and he wasn't sure what his options were. So this dentist, who refers to me a lot, his father, who's a dentist, comes in, and he's looking for solutions. I mean, can you imagine? It kind of shows you what's going on out there. So what we did for this guy is we took out the remaining teeth, and we placed 7 implants on the upper arch, in the upper and the lower, and we gave him a fixed prosthesis, fixed denture, fixed complement of teeth the same day. So he walked in with his bad infected teeth. We took them out, we cleaned them up, we placed the 7 implants on the upper arch and in the upper jaw and the lower jaw, and he walked out that same day. This guy he didn't even think that this was possible in dentistry. And
So
he
he's
was
a dentist.
He was practicing. Obviously, he's not practicing, he's not practicing up to date, but I mean, and actually.
What does he say when it's all done?
Truth of the matter is he was told by another dentist that he had no options. I mean, he didn't want to see his son because he was embarrassed. And I got to tell you, this changed his life, And the son still calls me every day to thank me. I mean, it's amazing. It really is. So, I think that's why a lot of patients don't come in. They've been told they have no options.
So there's a lot of people like that.
Millions of patients every day are told that they have no options.
Does it frustrate you?
Yeah, it's kind of sad, actually. I mean, why shouldn't they be given these options? These people deserve another shot at life. And this is what changes it.
So we're out of time. Okay, so you're never too old to get dental implants.
Yeah.
According to you, right? And even if you've been wearing dentures for 30 years, you're still okay.
Yeah.
You can get something done, fix set of teeth. They go in the day of the surgery, they walk out with teeth.
Yeah.
And they could eat that same day.
They can eat that same day.
And pain is not something you say they should be worried about.
Most patients.
Okay.
Most patients.
Okay. But finally, what about people, though, that they've been, they have really bad gums?
Yeah.
How do they do
And
it?
those are most of the patients I see. The patients that, have gum disease and they're losing their teeth. The bacteria that cause gum disease don't affect the implants. That's amazing. I mean, these patients are great.
So you could still have bad gums that get dental implants?
Yeah, I mean, when you take out the teeth, there goes the bacteria. So the bacteria that affect the teeth are not going to affect the implants. I tell you,
So the gums get better?
the gums get healthier. There's no more bleeding. The patients feel better. I mean, it's amazing. You've taken away all their infection, and they have something to chew on. So.
All right, so every single day you believe because you told me on the phone, I'm transforming people's lives.
I think I'm making their lives better. And for the patients that were told they didn't have any options, I mean, you're making a friend for life, to be honest with you.
Are you the go-to guy where you are, by the way?
You know,
I talked to your partner. He says you're a very humble guy. You know, Dr. Jackson, he doesn't want to brag. He said you're very good. The people travel distances to see you.
Listen, I work hard to make my patients happy. I mean, really, that's at the end of the day, that's really what you have left is, you know, your patients happy. Do they like you? I mean, have you changed their lives? Have you impacted their lives? And that's kind of my philosophy.
So sedation, by the way, you offer sedation? I mean, people could be...
Yep, we have an anesthesiologist on staff. And, you know, it's funny, actually, most of my patients, they just want nitrous and Valium.
Is that right? So a little nitrous, a little Valium, and that's it.
I mean, we offer all the options.
So during the procedure, they don't feel pain?
It's funny. I mean, I have some patients that wake up after the procedure. If we use the anesthesiologist, they wake up and they're like, okay, can we get started? It's over.
So this is IV sedation we're talking about?
Yeah, IV sedation. We're not doing general anesthesia. I mean, most patients don't want to go through that. And for the patients that are scared to have IV sedation, nitrous oxide and some oral sedation. And, you know, those patients, they sit there, they're happy. You know, they'll listen to their Walkman. Actually, I had one guy reading the newspaper as I was working on him. It was actually funny. I was, you know, was surprised.
And they could eat broccoli, carrot. I mean, when it's all done, they get a fixed set of teeth in their mouth. When they're healed up, they could eat like a carrot.
Anything they want. They can eat anything. It's like having your natural teeth.
Juicy steak?
Steak, corn on the cob, apples, carrots. I mean, they can chew on anything. Just like the natural teeth.
Even better? You say it's a third set of teeth.
Yeah, I mean, it's the one God wouldn't give us. So we've made it for them.
Good. All right. Final message, somebody, and we're out of time, somebody that is watching this and they're still afraid for whatever reason. What do you say to them?
Come in. Let's discuss your options. You know,
good.
Let's figure out what your options are and see if you're a candidate, and we can make it happen. We can change your life.
Good. I want to thank you for coming to the show. Great stuff.
Thanks.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.